Hi and welcome, it's Phil here. It's just gone 2 o'clock UK time and today I'm talking about pain. So if you're somebody who's interested in pain, either you experience it or you know someone who has it, this is designed to teach you a bit about how pain works, and we're going to start to look in this video, but more in the second video I'll be doing tomorrow, on how you can start to shift pain, some stuff you can do that will make a difference. But today is mainly about how pain works. Now, if you've been on Facebook, which hopefully you have, philparker.author, you'll see I've done a lovely infographic all about pain, and I'm going to explain it today with some wooden spoons and a lemon, sorry, not a melon. So, I hope you're sitting comfortably. You can watch this on catch up as well, but if you have any questions, pop them down and I will attempt to answer them if they fit within the remit of today's video. So if you look at the infographic, the first thing it says is there are two types of pain. There's acute pain and chronic pain. So acute pain is when you tread on a nail, you bash your toe, you cut your finger, and you get a sudden experience of discomfort. And the purpose of that is to warn you that something's gone on. But as we all know, there's a natural cycle to that, whereas it hurts, it gets worse, then it recovers, it gets better, and then the pain goes. And that is normally what should happen. Remembering pain is all about our response to threat and awareness of threat. And in fact, there's a whole bunch of research now that says we need to really move away from the old ways we had of thinking about pain. We used to talk about pain pathways, we used to talk about pain receptors, but actually nowadays we're not talking about this at all. We're talking instead of threat receptors. Because one of the kind of weird things about pain is if you stab your hand or cut yourself or bruise yourself here, it feels like it's here, absolutely, but all the research says it's not here. The pain is not here. The pain is in our neurology, in our brain, in our processing systems. So they're starting to move away from the idea of pain receptors and pain pathways and talk about threat. So you say, as you sit listening to this, if you're sitting on a hard chair, then your bum will start to become a bit numb after a while. That will start to just send some messages up your spinal cord to your brain to let you know that there's a bit of compression in those tissues. The blood flow's not flowing as well as it should do. If you stay there for a long time, then that could then generate into a big enough signal that tells you, ooh, something bad is going on here, which we interpret as pain. Now, when we say pain is in the brain, not in the tissues, that sounds weird because that's very counterintuitive. Our experience of pain is it's here, that's where we feel it. But the evidence is it's not, it's in the brain, it's in processing. And one of the bits of research that tells us this is those guys who go to war and lose their limb, where even though they've lost a limb, they can still feel a pain or an itch in a toe that they don't even have anymore, which reminds us, although it feels like it's over there, it's not, it's in the processing. So we talked about acute pain. Acute pain comes as a result of threat or injury, then it goes, hooray. But chronic pain is something different. Chronic pain is when the pain outlasts the problem. So the problem itself has gone or reduced or is no longer of interest to the body or the brain, but the pathways are still active. So when you try and fix those kind of pains, let's say your pain is here and it's a chronic long-term problem, then if you try and fix there, that's not where the problem is. The problem is somewhere actually along the nerve that goes up into your neck and then up into your brain, or somewhere in the brain processing centers. That's where we need to look. And as I said, that seems counterintuitive because when we experience pain, and we all have in our lives, it really feels like it's here. And the idea of looking somewhere else is a bit weird, but that's what we need to do. So how does chronic pain get set off? Well, there's a number of different factors they think happen. The first thing, and do ask any questions if you're watching this, just put a comment down and I'll answer it. So how does chronic pain get set in? Well, very often it will start with an acute pain. Something will have occurred that starts this pathway, this signal. So talk about signals, here's my lemon. Basically with a nerve, nerves are a little bit like wires, so imagine these two ends of the wooden spoon are wires. But in the brain, the nervous system, they don't actually join together like that. There's a little gap between them, and the purpose of this gap is what's called a synapse. Is like a switch. It allows the nervous system to decide, does a signal, so here's the lemon represents a signal coming along, does it get to jump from this nerve to the next? And there are a number of ways that it can do it. It's got a bit of a jump to go, and there are little things called neurotransmitters, which you're probably familiar with, and the neurotransmitters carry it across from one of these wooden spoons, one of these nerves, to the next one, and then the signal continues down this one here. I haven't quite got enough hands to do this. The signal can continue down this nerve, and eventually when it reaches the end, it will ring the bell. It will cause the pain, get the experience happening. So that's what happens. Now, in this little gap that we talked about called the synapse, lots of things can occur, which we'll be talking about, but you've heard about neurotransmitters which carry it across. If you produce more neurotransmitters, then it's much, much easier for this to be carried across. They're a little bit like taxis. They will carry people across, ferry these signals across. There's more taxis, more signals will go across. If there's no taxis, like in London when it's raining, there's no taxis, then the signal won't cross, and as a result, this second nerve won't be triggered. Nothing will happen. Other things that happen, well, there are some drugs that block some of those neurotransmitters. Opioids, so morphine, heroin, all that kind of stuff, they have an impact on the transmission of that signal. So the signal comes along, the acute pain signal, and it gets transferred to the next nerve. Off it goes and causes the experience, the perception of pain. We know pain is a perception because different people have different responses to the same stimuli, so high and low pain thresholds. But what happens when it becomes chronic is, as a result of constantly triggering this pathway comes along, then an interesting thing happens. The more it gets triggered, the more there become changes both in the nerves and in the synapses. So that one of the things that will happen is you'll have an increase in receptors. Now, the receptors are very sensitive to these neurotransmitters. In long-term stimulation of these pain pathways, some of the receptors on this side start to develop, very particular ones called NMDA. That's got that right. And when these are switched on, it means that a very small signal now produces a massive response on this one. So it's much, much easier for a small signal to produce a big, big response, and that's called sensitization. It also means that you'll also get a much bigger response for a much smaller signal, so it's a much louder noise as a result of a tiny little signal. What other things happen? Well, there's loads of stuff happening, because the other thing that happens is as this little signal travels from the hand, let's say, towards the spinal cord, as it goes up, if it keeps on doing this, it gets more and more signals, then you get another effect at this end, where the hand actually is, where it produces something called substance P. And substance P is a pain chemical. It produces pain, it produces inflammation. It's kind of, and it's worth noting that inflammation isn't bad. The point of inflammation is when you've got a problem in your body, it draws in all the goodness that you need to fix it. So it attracts white blood cells, brings all sorts of chemicals in to make a change. So what it does is it produces inflammation in the hand. Okay, so as the inflammation in the hand occurs, that unfortunately produces more of these pain signals, which then send more of this substance P and other substances as well, which create more inflammation, more experience of pain, which create more of these signals. So if more of these signals roll up, the synapse itself gets more and more excited. And in fact, the other thing is that we've got this one, these two wooden spoons, that the pain signal pathway, but there will be another pathway next to it, and we've got the little, I've got another wooden spoon here, and this one's a silicon spoon, the red one. What will happen is, as this area here, between the two wooden spoons, gets excited with lots of chemical releases, some of these chemicals will actually drift and affect this synapse with whatever this one's synapsing to. Could be a pathway towards pain, could be a pathway towards different sensation, could be a pathway towards tension, stress, all sorts of stuff. So you get this crosstalk going on. This goes up to the brain then sends signals back down another set of pathways, which then tell the tissues what to do. But what can happen as this cycle gets more and more wired, more and more hot, some of the signals coming down can get quite confused. And so then what you get is you get signals coming from the hand. Let's say this is the lemon in the hand. It comes up from the hand, it goes up to my brain, passing various synapses. As it does, as all these triggers come the synapses get hotter and hotter and more excitable, producing more and more chemicals which can crosstalk to these red ones that we talked about, which send signals up to the brain, which then send signals back down to the hand, which then confuse the hand, which send more messages. We start to get into this vicious circle where just the fact that you've had this pain for a while now starts to create this loop where the signals from the pain, from the tissues, are creating such a kind of flurry of activity in your nervous system that it responds by sending almost drunk signals back to the hand, which keep this loop going. Now there's another thing which many of you who've watched my videos will know about, because I talk about it a lot, which occurs, which is when the brain is being triggered, or when the nervous system is being triggered in a very particular and persistent way. So that could be when we're learning. Learning is a triggering experience. When we learn to play the piano, when we learn to play the guitar, when we learn to write, we repeat certain actions. Well, what happens when we repeat a certain action? It becomes easier to do. That's just the way it is. And why is that? Well, because there's a phenomenon in neurology called neuroplasticity, which means the more you use a particular pathway, the stronger and more dominant it becomes. And how does it do it? Well, it does it like this. Let's imagine, I think we've just about got enough fingers for this. Let's imagine we have, there we go. We have these two pathways, okay? We have one to calm and one to stress. And this is the pathway coming towards them. We send the lemon the signal down this one, okay? It runs along, and let's say in this case the lemon jumps onto the wooden spoon, okay? On this one, not onto the red one, jump the signal, so the signal jumps between these two. If that keeps on happening again and again and again, then what will happen is the wooden spoon will move closer to the wooden spoon and the red one will move away. So we see that change in the synapse. So now it's much easier for the signal to come from this wooden spoon into that one than it is to go into the red one. And this is called neuroplasticity, where there's a move from here, where equal chance of either of these wooden spoons or plastic spoons being triggered, these nervous system bits the nerves. And as we trigger it, if we keep on using this one actually moves closer, and the red one, as you can see, moves further apart. And that's neuroplasticity. So the more we trigger a pathway, the stronger and more dominant it becomes. So if we have one of these cycles where we've got this signal coming from the hand that's triggering the brain, that's going back to the hand, and we get this signal, and we also get those reverse effects where you start to get substance P produced in the tissues, then not only does that happen, but we also get the neuroplastic change of those nerves getting closer together, so it's easier for that pathway to run. And that all starts to get a bit messy, because if the pathway that you're running is a good pathway, like learning to write your name, great. But if the pathway is a pathway of pain and stimulation of those kind of sensations from this part of your body, that becomes very, very problematic. So, got any questions about this, then do put them down, because it's quite complicated stuff, but if you know a bit about basic neurology, it starts to make sense. So the more we use pathways, the stronger they become. If we trigger a particular pathway again and again and again, the pathways get closer. We also produce different receptors if we constantly use a pathway, and suddenly we're in a position where everything is getting triggered all the time. There's another interesting phenomenon that happens within sensitization, which is this. Let's imagine we have the lemon rolling down the pathway. Okay, here we go. Let's see if I can hold these two. Okay. So here comes the lemon, he's rolling down the pathway, and as he comes down, he jumps across the gap and triggers this, here he is, I'm going to wiggle him, this second neuron to fire. Okay. What should happen when the lemon goes away is this pathway no longer fires because there's no trigger. Okay. Well, what can happen in sensitization is the lemon rolls down and you get a firing, but the firing doesn't stop. It should go away, but just keeps on firing. Then what can happen is you can find that in the absence of any stimulation, this neuron just fires. And when that happens, again, you've got a good example of chronic pain, where it feels like the pain is coming from the hand, but it's not. It's actually just being built by this neuron itself. There's no inbound stimulation. It's just happening all by itself. And this is called sensitization, and that happens a lot. Interestingly, one of the interesting things about sensitization, So it sounds like a bad thing, but there's a time that we use it all the time. I wonder if you can think what that is. Well, one of the times we use this sensitization is in memory. When we create a memory, what we do is we produce a signal. Here's our lemon again, coming down the nerve. It jumps into the second nerve, here it is, and that causes an experience. Maybe, it's so nice to be on holiday drinking a pina colada. That could be the neuron that you just triggered, the pina colada neuron. Here it is. Now, when you sit at home and it's a bit grey outside, you may remember the pina colada. There is no pina colada triggering it. It's just purely an internally driven experience. And that's what memory is. Memory is the ability to trigger neurons when there's actually no external trigger. It's rainy and cold. We're not in Barbados drinking a pina colada now, but the signal is still being triggered just by us triggering it, which brings us on to the final part of chronic pain. So far we looked at the neurology, the physiology of it, how it kind of works, how that makes sense. But of course we're humans, so when we experience pain, we're not a test tube, we're a living organism, and that affects us emotionally. And it's impossible to talk about pain without not looking at what are the consequences for us as a human of experiencing chronic pain. What does life feel like? Well, generally it feels pretty shit, because you've got this constant companion that you don't want, which is pain. You think about it a lot of the time, you experience it a lot of the time, and it just keeps on running. And so the other thing, and there's some good research into this, that we recognise is not only the more you think about it, the more you talk about it, the more you trigger these pathways. So just saying the word, and this is one of the unfortunate things about this seminar, saying the word pain will trigger those neurons without any actual direct external stimulus. Just the word, just saying it to yourself will trigger that. And that gives us a clue, of course, to one of the things we need to do if we want to reduce this experience, which is to stop using the word. But I'll talk about that more in the next video I'll be doing. So we know that lots of things will trigger it. The other thing, of course, we'll find is expectation. If we've had lots of experience, when we do this movement, it causes this pain, then even thinking about the movement starts to trigger the experience. And obviously that stops us from doing it, because our body goes, when we think about this, it's not just a thought, it creates a response in the brain that says we need to do something about this potential threat. In the same way as if anyone's ever been anxious, I used to be really, really scared of dentists. I'd look on the calendar and see 3 months from now there was a dental appointment, and I'd go into stress just looking at it in the calendar. I wasn't at the dentist, I was just reading it. So we know that this can have a massive physiological response. In this case, my shoulders would tense, my breathing would change, I'd start to go hot and sweaty. In the same way, if someone has a very well developed pain pathway, or pathway that triggers the experience of pain, then if you trigger it just by going, if I do that exercise it's going to make this happen, then the body will create a response as if it is happening. Okay, so we'll send messages down to the tissues to tighten up, to maybe produce a bit more substance P, to produce some inflammation. So we get this overload, this psychological, physiological overlay, where the concern and worry, which is natural about having pain, also has a physiological effect. We also then get into a pattern where we just experience pain all the time, and it feels like it's never going to go away. And that sets up another set of pathways that lead us into not a very good place, that start us to doubt whether we could ever recover, and make us focus on a life filled with this. And those pathways again establish extra pathways about predictions about our whole future, not just about tomorrow, but about next month. And one of the things we look at a lot when we work with people is help them to sort this physiological cycle out, but also start to look at how they're building that pathway every day just by the normal thoughts you'd have. Because if you have pain, of course you're going to be worried about it, thinking about it, concerned about what will happen if you do stuff. But each time you do, unfortunately, that rewires this pathway in ways that aren't very useful for you. So that's an overview of quite, some of the complexities of pain. There's loads more I could talk about the way that the cell potential and the membrane potential of the nerve cells is affected and allows change to occur across the whole of the nervous system, synapses, the glial cells, which is mentioned, I think, on the infographic. So the glial cells are cells that hang around the nervous system. Their job is to support the nervous system. to take care of it. But when they get activated by this incessant chatter through nervous systems, they kind of become a bit weird, and they start to become attacking. They start to produce more of the substance P, more sorts of neurotransmitters, start to create inflammation, and it's almost like they go rogue. There's probably a good reason for it physiologically, but the consequence of it is you've now got another problem that's adding to this. Now, if you listen to this, you might go, oh my God, A, that's very complicated, and B, what am I going to do if it's all going on? Well, the good news is that actually, because it's all in this neurological cycle, neurology is actually quite easy to affect, to settle down, to calm down, if you know what to do. But obviously, if your nervous system has got wired into this, then it's much more difficult to do that. I've got a question here. Let's read it. Appreciate that thinking about pain triggers pain, but isn't it bad to ignore our feelings? Shouldn't we acknowledge them? Otherwise they'll keep coming back if they're repressed. What do I think? Thank you for that, Holly. That's a huge question. Have we got time to cover it? Probably not on this one, but maybe on the next one. The reason it's a huge question is there's a huge amount of presuppositions within that question. That first of all, emotions exist as a thing independent of our nervous system, that they just are lying around being triggered or occurring, rather than emotions are actually a neurological phenomenon as a result of either thinking about something in a particular way or experiencing something in a particular way. So therefore the idea of repressing them, it comes from a different model. The idea of repressing them says, I have them, they're stuck inside me, rather than there's something I'm actually generating that I have the chance to change. So a good example of this is, let's imagine you email your friend and you go, hey, how you doing? Do you want to come out for dinner tonight? You get nothing back. So you send them a text and you go, hey, do you want to come out for dinner? Don't know if you got my email. You get nothing back. You phone them. As soon as you phone them, it goes to the first ring and you can hear them hanging up on you. Now what do you start to think? You start to think, I wonder if I've done something wrong. So you go to their desk and you wave at them and you go, hi, and they turn their back on you and continue talking on the phone call. And you're thinking, what have I done? This is dreadful, something's bad. So the emotion is very clear here that something is wrong. Later on you bump into your friend, or the person you probably now think is your ex-friend, and they go, oh look, I'm really sorry I couldn't talk to you when you came in. My mum was just dying on the phone, literally, and I had to deal with that, and so I just had to focus on that. And my email's been down all day, and my texts haven't been working. My phone, I dropped it down the toilet, it's not responding properly anymore. What happens to those emotions when you now understand that the emotions that were real weren't real? They were genuine physiological, neurotransmitted emotions, but they were inappropriate based on the context. Should we express those emotions? Should we be close to them? Or should we realise that actually they were very strong and real, but they're not accurate? And so that's why it's a good question, but it's a very, very big question about what is the role of emotions? What should we do with emotions? If you look at some Buddhist thought on this, it's very interesting. There's a nice conversation between the Dalai Lama and Richard Gere, where he says, Richard Gere says exactly this question. So, well, aren't emotions real and we should honour them? And the Dalai Lama says, what do you do for a living, Richard? And he said, well, I'm an actor. So he says, when I see you on the screen being absolutely convincing that you are, an action figure or sad, so are you sad? He goes, well, I have to get into character to be sad. He said, but are you sad? He says, well, no, I'm just an actor. Yeah? So this whole idea that emotions are, we do need to honour our emotions, but we also need to work out whether they're appropriate and relevant, or whether they're coming from some not very useful way of thinking about stuff. And that's a whole nother video. It's a question from Petra. How can we solve the problem of chronic pain? So yeah, today what we're looking at is how it works. Next video I'll be looking at is some tips for you to start to think about how you can change it. But what I suggest you do, because it's your nervous system, having talked about what's going on, think, okay, so then what would need to happen to start to settle that cycle down? Even in the event that you have something like arthritis, So there is some trigger. What can we do to settle that down to reduce the impact of that on our lives? So I'd like you to think about that, and that's where I'm going to leave this today, is think, okay, well, if that is going on, then what do I need to do to make a change? And tomorrow I'm going to be suggesting some things. 2 o'clock UK time, going to be in the same place, same cushions, same backdrop, possibly a lemon, and I'll be talking about some ideas you can use from the lightning process, from other perspectives, on what you can do to help to make change. Because the first thing to know is you can make change. This is your nervous system, and once you've got some tools, you'll be able to make some change. I think one of the things I'll do tomorrow, so make sure you're not driving, is I'll teach you a bit of hypnoanesthesia. So how to switch off signals from certain parts of your body just by thinking about it, because that might be quite interesting. Because if you can do that, then it makes you think, well, what else could I influence using the way I use my brain to influence my nervous system? Till then, I'll see you then, guys. Bye.